In the debate over whether or not to mask, a division is emerging between public health officials and medical professionals on the front line. Doctors are urging targeted mandates, but BC's top doctor refuses. CTV's Penny Daflos has that story.
10-hour waits at BC Children's Hospital. Upwards of 240 kids a day at Surrey Memorial emerge, and 6 kids already dead from influenza-related illnesses. BC's healthcare system has never faced such pressure. BC doctors on the front line say it's time to escalate efforts to dampen all respiratory infections.
I would absolutely love it if everybody took the time to think of kids who are suffering, kids who are sick, and put a mask on.
And from Ontario,
just strong recommendations are not enough.
To Vancouver, some call for a stricter approach.
We need mandatory masking in closed indoor spaces. Nobody's asking for lockdowns.
There are no province-wide mask mandates in Canada right now, but official messaging varies greatly.
I'm strongly recommending that all Ontarians, not just those at high risk, wear a mask in indoor public settings.
While in British Columbia,
masking is one of the measures that is needed in certain situations.
Our provincial health officer continues to reject the idea.
A mandate is a rather heavy-handed measure that we do as a last resort when it's something that is absolutely needed.
I certainly wasn't expecting that we would find this big of an effect.
Research in the New England Journal of Medicine shows Boston schools that lifted mask mandates saw a surge in COVID-19 infections compared to those that didn't. This researcher points out we don't have to bring back all strict public health measures to reduce illness.
Obviously, we can't do all of those things again, but which things can we do that either are sustainable or can replace in a more sustainable way?
The public health officer now doesn't seem to be offering the government straight up medical advice, but is couching that advice with political and economic considerations.
And likely the desire to avoid the kind of clashes we've already seen between hardline anti-maskers and those trying to follow the rules.
She is going to be attuned to public opinion. But at the end of the day, she is a doctor who should, in my view, be listening to the medical community, to the advice that they're offering from the front lines.
And Penny Daflos joins us now. Penny, Premier Horgan had always pointed to Dr. Henry when it comes to decisions about mandates. Of course, we have a new premier. Is any indication that Premier Eby is going to change course like there?
You know, I tried to get an answer to that. I reached out to the Premier's office today to ask, does David Eby plan to be more hands-on, take a greater role in decisions involving the pandemic, including mask mandates? They haven't responded yet, but to be honest, I can't really imagine any Premier is terribly keen to have his province be the first in the country to bring back any mask mandates. The situation in our children's hospital, however, could be a deciding factor, mi-jung.
All right, thank you, Penny.